Hello, I'm Patty Heidemann. I'm a mother of 4, grandmother of 3, and I've been a nurse for 35 years. Primarily for the past 15 years I've been working with acute psychiatric patients, mostly adolescents, in an inpatient setting. We offer medicine, psychotherapy, activities, and more for these patients, but there's been something that's always been missing. Intuitively, nurses have compassion, and we know that holding a hand or putting our hand on someone's shoulder and offering some quiet time can often be more supportive than some of those other measures. Nursing school trains you scientifically. You learn about medications, you learn about different treatments, but there's been no alternative therapies offered, especially 35 years ago. I went to a women's retreat 3 or 4 years ago as I was feeling exhausted from life stresses, work stresses, and I had an energy therapy I'd never had before. After that energy therapy, I felt lighter. I can't describe how I felt, but I remember sitting with some of my friends and just saying what an amazing experience that was. In the evening, I had a massage by a little elderly nun. It was an amazing massage, but what happened after was even more amazing. She sat with me for a few minutes and asked me about my path. I told her about my family, my nursing, and she took my hand and said, "You need to be working with healing. You need to get interested in touch therapies and ways to heal yourself and your patients." And it was an aha moment. Immediately I found a site about Reiki training, and I signed up for that and got my Reiki training and became a Reiki master. At the same time, the hospital that I work at sent a memo around asking if there were any nurses interested in clinical aromatherapy course. Again, I thought this would be wonderful. I applied for it and began a year-long program and became a clinical certified aromatherapist. I use it mostly for myself at this time because it's been difficult to integrate it into my setting. My hospital is supportive but is unsure on how we can make this work. I use it for friends, giving them inhalers, aroma baths. I've done Reiki on my grandchild when she was having a stressful time. I do daily self-Reiki, aromatherapy baths to help relax, using inhalers and spritzers, all to try to help me be a better person so that I can do the things that I need to do in my life. Patients, family, caregivers all have needs that go far beyond what medicine can offer right now. My friend's husband died from Alzheimer's 4 or 5 years ago, and he was in a nursing home, and it was evident that the caregivers there, the patients there, all had burnout. It's a stressful time. People don't know how to take care of the patients properly, and they don't know how to take care of themselves. I did speak to a group of caregivers and family members for Alzheimer's and talking about aromatherapy, and would love to be able to pursue this more with them. I've worked with a senior center that my friend is a social worker at, and did Reiki and aromatherapy for the clients there at an adult fair they had, and they loved it, and they felt so relaxed. My stepfather's 94, and he and my mother live next door to me now, and he is ill but still able to get around, but hospice became involved because he has lung cancer, and they were wonderful, wonderful, supportive people. But I could see how aromatherapy, Reiki, yoga could offer so much more to him, my mother, and the caregivers that are scooting from patient to patient daily, doing the very best that they can. I was so excited to learn that Donna Karen has an Urban Zen program that is trying to integrate all of these different modalities. My friend showed me this article 3 or 4 years ago that I believe was in Vogue, and I read it and just thought, this is how it's going to happen. I cut that article out, I sent it to my administration, And I have carried that around in my day planner, which goes everywhere with me, for the past 3 or 4 years. And I take it out and I read it. And I know that this is supposed to be my path. I just have not been able to figure out how I can integrate it into my professional life and my personal life. My community has runaway shelters for adolescents, has a psychiatric ward, has senior centers, has hospice, all of which I know I could make a huge difference with if I was able to bring more of these modalities. Your program puts into action a structured approach, something I've always believed in treating, the mind, body, and spirit. The scholarship would be my dream come true, to be able to attend this year-long program and be able to introduce it further into my work and my community would be perfect. That was probably